The hard thing are the gray discussions. And I think a combination of a few things, listening to the parents, not just talking, particularly when there's time, um, brutal honesty, not sugarcoating things. I've seen a lot of doctors sugarcoating bad news. It never serves the patient well, it never serves the family well, and it never serves the relationship well between doctor and patient and family, which has to be built on a sacred trust. And then compassion, putting that family, putting yourself in their shoes. God forbid, I've given horrible news hundreds and hundreds and thousands of times, but you never know how you're going to react when you're on the receiving end of that news, even if you've given it hundreds of times. So just having compassion, saying words that you would want to hear if you were in their shoes, and having to make these impossible decisions. It's funny, it may be better at some medical schools these days, but I received a lot of training on how to do brain surgery. I received zero training on how to have difficult conversations, none in my entire career. But I watched as when I was a medical student, and when I was a resident especially, I watched my mentors have some of these difficult conversations. Sometimes I cringed because it was awful what they said. Um, just not mixed in with the appropriate level of love and compassion. And sometimes I was like, wow, that was really well phrased. And so what I do now as a teacher, as a faculty member, is whenever I'm going to have one of these horrible conversations, I look around and I hope that there's a resident or a medical student or somebody younger than I am around that I can take with me. And as I'm walking quickly to have that conversation, I tell them what I'm going to say and how it's going to go. And and afterwards, I check in with them and make sure they're okay emotionally. And then I tell them, you should take what you liked from that conversation and employ it when you have to be the bearer of bad news one day. And what you don't like, don't use. And, watch a lot of people do this and pick the best from each of them. So I didn't really learn from any instructor or anything. It's just by watching other people and picking the best and the worst and making a plan.